Hello, everyone. We'll wait a minute until everyone's joining. It looks like we've got quite a few of you here. So just give us a second as everyone's getting in the room and getting connected. We're excited to see you all here today. All right, well, thank you for being here and welcome to the first NBPHE Summer CPH Review Session. My name is Ashley Mueller and I'm the Manager of Educational Programs at NBPHE. During today's session, I will monitor the chat, and if you have any questions for our presenter, please put them in the Q&A section, and our presenter will answer questions as we have time at the end of the session. Chat is also open so that you can interact with your fellow attendees, put where you're from, how far you're into preparing for the CPH, and just have general interaction with everyone here today. So today's topic is the overview of certification in public health presented by Allison Foster. Allison Foster is the president of the National Board of Public Health Examiners, which administers public health certifications, including the Certified in Public Health credential. In this role, she is responsible for the governance of NBPHE, as well as operations, including the administration of the CPH exam. Allison lives in Arlington, Virginia, and is very active in the nonprofit community in the greater Washington, D.C. area. So with that, I'd like to turn it over to Allison for today's presentation.
All right, well, thank you, Ashley. And could you just confirm that I'm sharing the right screen? Great, okay. Because we've all made that mistake, I'm sure. So my name is Allison Foster. I'm the president of the National Board of Public Health Examiners, and I'm so excited you all are here today. You're going to get off on the right foot of hearing everything holistically about the CPH certification. So what I'm going to do today is I'm going to give you a little background just to talk to you about why certification in public health, maybe give you a little motivation. And then we're going to dive a little more deeply into eligibility, the application process. We're also going to talk about the exam itself, what's on the exam, what you can expect, and then some tips on preparing, and then we'll talk about recertification. So. All right, so the National Board of Public Health Examiners is an independent organization. We're a nonprofit. We were founded in 2005 to certify the public health workforce. And as such, our board of directors, and sorry, my slides are not, there we go. The board of directors is comprised of individuals representing a number of different public health organizations. So we represent academic public health practice, membership organizations, accreditation, etc. So we've been around since 2005, and since then we have actually certified almost 13,000 public health professionals. So we are based in the United States. That's where I am. However, we are not a US only certification. We've certified candidates from or in over 95 countries around the world. So first, I'm just going to talk to you a little bit about the importance, give you a little perspective on why certification in public health. So this is not a new idea. So prior to the NBPHE, there was no certification for public health, but it was absolutely not a new idea. There have been conversations going on for about 25 years, dating back to 1980. We'd have think tanks, different organizations get together. We had the Surgeon General call for certification of public health. CDC has had calls for certification in public health. And you know how that goes sometimes. There's lots of good intentions and a lot of thinking about an idea, but finally in 2005, two organizations, ASPH and APHA, came together and said, we need to make this happen. So they created the NBPHE, and then we were off and running. So why all these discussions about certification? Why was the NBPHE created? Well, so there's been a call for discussions over the years that there's a need to professionalize public health. And I realize that you all are probably in the field and very aware of this, but public health is under prioritized, underfunded. it, tends to take a back seat when it shouldn't. And it's, in my opinion, the most important field in the world. And the thought is that if we could professionalize public health and really give it a common body of knowledge, a way to bind us together and to make it more recognizable as a profession. Each one of you has a different title, a different degree, you work in very, very different settings. It's such a broad field, and that's its strength, but also it's lacking in something that really binds it together. So the idea is that we needed to professionalize public health. So there's sort of rubric that's commonly thought of as what defines a profession. So there are three components that typically define a profession. The first is most professions have degree programs. So we've got that. Public health has that. We've had degree programs for 100 plus years. Accreditation. So accreditation is the review and approval process for organizations. So an individual, a person can't be accredited. It's always an organization or company, etc. So we've had accreditation in public health since the 1970s. We've had accreditation for schools and programs. There's accreditation for health departments, etc. So that's not uncommon. What we have not had is licensure or certification. And I do kind of put those together. So they're very similar concepts. Licensure is actually administered by the government, and certification is administered by another agency, which would be, in our case, the NBPHE. But we haven't had that. There are some specialty certifications in public health, certainly, but we haven't had certification to work in the field of public health. And that's just the idea, is that this is the third leg of the stool that is so important and is missing for public health. And if we had that, it would really move the field forward. So one question we get is, examples of, so what other professions have certification? But we also get the question, but we have degrees, why do we need certification? So I'm going to go ahead and answer that question. If you think outside of public health to just numerous other fields, most other fields have both. So this spring, if you're here in the US, you filed your taxes. Probably the person who helped you with your taxes was a CPA. I can almost guarantee they had an accounting degree and a CPA. Physicians, you hear about physicians being board certified. They have a medical degree, and they also are board certified, which is very similar to what we do. There's so many other examples. So just look around. Think about other aspects of your life, people they're professionals in a specific field, and very likely they have both degrees and certifications. They're very complementary. I actually have a whole presentation I won't go into today for the sake of time. But degrees and certifications are very complementary. They're not meant to replace each other. But they are different things. So there's degree programs, which you would earn at an institution of higher learning. And once you have a degree, you have that degree. It means you gain that knowledge, and nobody can take that degree away from you. There are certificate programs, and I just want to mention that while we will give you a certificate if you are certified, we're not a certificate program. Those typically are a set of courses that you take. And then when you complete those courses, not a degree, but just a set of courses, once you complete those courses, then you get a certificate. Not quite what we do. We're a certification body. Now I'm going to go through the steps in a moment, but certifications are basically an assessment of competency. And once you earn the certification, you need to renew periodically to keep using those credentials. So let's talk about, it's important for the field. I hope I've made that point, that it is going to help all of us if folks are certified in public health. But let's talk about why you might want to be certified in public health. If you're here, you've probably already got an idea why you want to get your certification, and that's great. There are so many different reasons. And what we find, I kind of look at it sort of on a scale. There are some people that get certified because they love public health. They think it is so important that there's certification in public health. And they want to move the field forward. And that's why they get certified. On the other end of the scale, there are folks that believe that getting their certification is going to help them to find a new job, help them in their current job. Sometimes there's monetary incentives to get a certification. Lots of different reasons, but I think a lot of people kind of fall in the middle, or both. So you certainly have your own motivation why you think you might want to get certified. So I'm going to play a video. What we did is we came into had some staff, or sorry, some CPHs come into our office, and our staff interviewed them. And it was really interesting because it was unscripted. We just asked them basically, why did you get your CPH? And they gave us some really great answers. So I'm going to play this video. It's about 2 minutes. And Ashley, just if the sound isn't coming through, well, just let me know. But I think it's going to work.
I graduated with my MPH 2 years ago, and I knew that I wanted to be certified in public health. My employer was thrilled to see that I have my CPH because they know that I'm a lifelong learner and I will continue to build my skill set.
I'm from an underserved community. I'm from Mississippi originally. That's why I decided to pursue a master's degree in public health. And I earned that a couple of years ago. And now with the certification in public health, the communities I serve will know that I'm up to date, I'm keeping up with my education, and I'm striving harder, and it will benefit those communities.
After returning from the Peace Corps, it was important to me to continue my public health education. As a community health volunteer in a rural village, I worked closely with decision makers and other community health volunteers. The CPH allows me to enhance my skill set through continuing education credits.
I took the CPH exam and got certified in public health as a self-affirmation of the knowledge and skills that I had received during my Master of Public Health program in Policy and Management. It was a fantastic way to share with my family and friends what I had learned during my 2-year program. It was also a great way for me to share with the general public that I care about my continuing education and want to advance the field of public health.
Even though my coursework provided me with the essential fundamentals of public health goals and initiatives, getting certified will help me excel in my work beyond the classroom to the broader hands-on field of public health, advancing my career as a public health professional.
I see the CPH as an opportunity to recommit myself to the field of public health and to renew my knowledge in all core areas, especially those that I don't get a chance to practice on a regular basis.
Getting certified in public health is a way for me to show my dedication to my profession and to also show that I'm up to date in the profession and I know what is happening and I can do my job.
All right. So what I want to talk to you now about is about the certification process itself. I'm sure you've got lots of questions. So the process itself starts with eligibility. So I'm going to show you a bit about how you can determine if you are eligible to be certified. Then we'll talk about the exam, go into a bit more detail. I'm sure you've got lots of questions there. And then finally, recertification. But these are the basic steps of any certification process. So eligibility. So we actually have lots of routes to eligibility because public health's complex and people end up in public health lots of different ways. We're really just wanting to confirm that folks have the competency. We don't have criteria based on one specific pathway. So that's why we have lots of different routes to eligibility. So I'm going to give you the simplest explanation that I can. So the first route is if you are a student, an alumni of a CPHE accredited school or program. As long as that degree program is CPHE accredited, then you'd be eligible to sit for the exam. If you're a student, likewise, in a CPHE accredited school or program degree, you'd also be eligible. The only caveat with student eligibility is that your school or program would need to determine that you've taken enough of the coursework so that they believe you could pass the exam. And typically, schools and programs define that as completing the core, finish your first year. They all might make the decision slightly differently, but at some point they will approve you as a student to take the exam. And once you pass the exam, you would have passed the exam, that's great, but you'd be in provisional CPH status until you have graduated from your degree program. And we also have a series of eligibility for folks who have not attended a CPHE accredited school or program. So in this case, if you have a graduate level degree that's related to public health, and we define that pretty broadly, and you have at least 3 years of work experience in public health, then you'd be eligible. And likewise, if you don't have a graduate level degree, you just have a bachelor's degree, but you do have 5 years of work experience at a minimum, you would be eligible. And so I'm sure, some of you might be thinking, but how do you define public health? How do you define whether the degree is relevant? We understand that. We do have some information on our website. We give some examples. We found it to be basically impossible to write out the entire criteria, so how we define public health, because again, it's a very broad field. So what we do is we try to give you some guidelines. So if you apply under our work experience criteria and you are not approved, we will fully refund your application fees. You're also welcome to email us if you just, kind of want to check and see what we think. But after you get the official decision, if you're not approved, we will refund your application fees. So the registration process, really pretty simple. So you just navigate to our website under the CPH area and then click on apply now, and it will take you to our system. It's a fairly simple application, no matter how you're applying. If you are applying under work experience criteria, you will need to have a copy of a college transcript so that we can see that you actually earned a college degree. And a resume. And then otherwise, it's pretty straightforward. Should only take you a few minutes to apply. So once you apply, you should be verified. Your application should be reviewed within about 2 weeks. That's our goal. That, occasionally it might take a little longer for one reason or another. Maybe if you are applying as an alumni or student, the person who verifies on the school end is out or something, for a little while. So if you ever find it's taking longer than 2 weeks, just send us a note and we can follow up. But I'd say 90% of cases, applications are verified within 2 weeks. So once you are approved, you will get a notification, and then within 24 hours, you will get a message from our testing partner, Measure Learning, that actually administers the exam. And they'll let you know that you can schedule your exam. So that's great. You're ready to schedule, but maybe life got in the way and you realize you need more time. Maybe you didn't intend to take the exam right away. That's okay. So unlike a number of different certification programs, once you're eligible, you're always eligible. So just set that email aside, and when you're ready to schedule your exam and take the exam, then you can schedule then. So we do not have a deadline by which you need to take the exam. You can, though, if you are ready to take the exam and you want to go ahead and test, you can usually test for 2 or 3 days, after you are approved, just depending on how you want to test and the location if you're going to a computer-based testing center, but you can usually test pretty quickly after you're approved if you want to do that. So our fees for the application and exam is all one fee. We don't have separate fees. It's all rolled into one. The standard fee is $385 US. But we also want to make it as affordable as possible to folks. So we offer discounts for lots and lots of different reasons. So if you are affiliated with an organization on our lists, on our website, if you're a member of an organization, if you have attended certain schools and programs, we've actually got more discounts than we could show right here. So you just navigate to the CPH section of our website, and it shows you all the organizations for which we offer discounts. And what happens when you apply, you will tell us, yes, I'm a member of, whatever the organization is, and then the discount will automatically apply when you check out. So for testing, we don't have windows. We test all year long. So quite literally every day of the year, someone could be taking the CPH exam. So whatever your time frame is, that works for us. So there are 2 different ways that you can take the exam. You can either take the exam at a computer-based testing center. We have about 1,400 computer-based testing centers around the world. So we have a place on our website where you can actually search for a computer-based testing center according to the zip code. And as you would imagine, you would go in, there would be people to meet you. They would, check you in for your exam, and then you'd have a dedicated computer for the exam period. One option that a lot of folks like is that we also test by live online proctor. And that means that you would take your exam in your home, in your office, any place you have a private space using your own computer. And I'm going to go into that in more detail in just a moment. So for the testing centers, this is what the search looks like. So you could click on your state, and then it'll pop open all the cities where there are testing centers. And then if you are going to be testing outside of the United States, then you click on international locations, and it would give you a list of countries and cities. So for live online proctor, we get lots of questions about that. It's a great way to take the exam. That's how I got my CPH. I actually took it by live online proctor, but there are some requirements. You don't just simply need to show up at a testing center. You've got to have the equipment and be prepared. So we have this video on our website, which is, I can't emphasize how helpful it is. It walks you through everything that you need to know. And I'm going to give you a little bit of information, but if you're thinking about testing by live online proctor, please watch this video. I think it'll really help you out. So basically with live online proctor, you need to have your own computer. You need to have a strong Wi-Fi connection. Your computer has to have a single monitor. You can't have dual monitors because there's going to be a proctor and they need to see what you're looking at. You have to have a camera and a mic. And a private space. So, you've got roommates, you got people walking through, that's not going to do. So you do need to be able to close your door and be alone in the space. That's mostly it. The rest is, we do have some technical requirements on our website, but almost all people that decide to take the exam by live online proctor meet the technical requirements, and there's actually a way you can test your computer. So if you just change your mind, you decide you want to switch from computer-based testing center or live online proctor, once you're scheduled, you can always switch back. So it does not matter to us how you test. We just want you to test the way that's going to make you the most comfortable because we want you to be successful. So the exam, sure you all are thinking about this a lot. The exam is comprised of 200 multiple choice questions. And there's no essay questions, just multiple choice. We call them single best answer. So we give a 4-hour window for the exam. We no longer say it's a 4-hour exam, however, though, because most people don't take the full 4 hours. The average candidate, our most recent analysis was 2 hours and 50 minutes. And that's the average. And the reason I point that out is because it's important that you've got the time to be thoughtful about your answers and really think through, the questions that you're seeing. And what these statistics tell us is that we are giving ample time so that you won't feel rushed. We don't want you to feel rushed taking the exam. We want you to take your time so you can feel successful. So this tells us that folks generally, as an average, have about an extra hour that they could use if they wanted to. And for candidates who need additional time for medical reasons, we also do offer a host of accommodations. So there's a process when you apply. We'll ask you if you need accommodations, and then if so, then there's a form that you can submit to us and get additional time or other things that you might need. So we also realize that it's a little nerve-wracking to take an exam. Some of you probably haven't taken one in a while. I felt the very same way. So hopefully this statistic will make you feel a little better. This is the percentage of people who ultimately pass the exam every year. So this does include retakes. We do have folks that don't pass the first time, but they end up retaking the exam. And as you can see, the candidates do really well. And the average right now is in the high 80s. So I hope that makes you feel a little more confident. And what I want to say is that part of the reason our pass rate is so high is because we set our eligibility criteria strongly enough that candidates, by the time they're eligible, should be able to pass the exam. So it doesn't do us any good to have candidates that aren't prepared. And so that's why we set the eligibility criteria the way we do, because we want you to pass the exam. So if you don't pass the first time, it's okay. You've got options. So you can turn around and retake the exam as soon as you want to. And we also do not have a limit on the number of times you can retake the exam. Every attempt after the first one is $150 flat fee. So you would receive a message saying, would you like to retake the exam? You can log back into our website, pay the fee. There's no verification process again. So by the next day, after you submit your retake fee, you will get another set of scheduling instructions, and you can take it like before as soon as you want, or you can wait as long as you want if you need to feel like you need to study a bit more. So what's on the exam? So before I show you the 10 domains that are actually on our exam, I want to just back up for a second and mention how we decide. So there's a whole process that goes behind determining what is on the exam, and it really starts with what we call a job task analysis. So again, as a certification body, we are trying to assure the competence of public health professionals working in the field. And the way that we determine what do public health professionals need to know is we do a job task analysis, which is basically it's a survey where we ask as many public health professionals as we can about the tasks that they're doing, how important those tasks are, and how frequently they do those tasks. And then we take the core of that, the tasks that seem to be most common and most important, and that is the basis of the exam. So we do this every 5 to 7 years because public health changes over time. So we do update our content outline and our exam every 5 to 7 years. And as you all know, we're about to make one of those updates. So you're going to be the first to take the exam under the new content outline. So this is what our domains will look like on August 1st. And so by domains, these are just groupings. So within each domain, there's a series of tasks, and you can find all these, the content outline on our website in detail. So these are just the buckets in which we put the tasks, just to make it a little easier to grasp what's on the exam. And you can see there, maybe the average is about 10%, but some domains are a little bigger, some domains are a little smaller. But hopefully when you're looking at this, at least some of these look familiar to you, and they really should speak to what the field of public health is overall. So I'm sure when you look at those domains, some of them you probably thought, well, that's what I do, or that's what I studied, or yeah, I'm really comfortable with that. And then some of the domains you might think, oh, I never took a class in that, I don't do that at all, and are less familiar. The good news is when we set our passing score, it's overall. So you can have domains where you're less successful than others. You can have domains where you struggle with and don't do very well on the exam, as long as your overall passing score is good enough. So when you take the exam, you will get a score report that shows you how you do by domain, but we're just sharing that with you so that you know. So otherwise, we just take all your right answers and we add them up. And if that meets the passing score, then you pass the exam. So don't let one, domain that worries you make you think that you can't pass the exam. You just need to do well enough overall. And just one little tip I'm going to throw in, you're probably going to get lots of them over the next few weeks as you go through this review session. But if you get to an exam question and you think, I do not know the answer to this at all, make sure you at least guess, put down an answer, because at least you have a 25% chance of getting that question right, because we do not penalize you for the wrong answers. We simply add up all the right answers. So if you leave a question unanswered, you have no chance of getting a point for that question. So I suggest that you just go through and make sure you answer everything at the end, even if you're stuck on a few. So normally I would break here and do a couple practice questions, except you're about to get several weeks of this, and I'm so excited. The presentations are going to be fantastic. So we're not going to do that now, but you'll get lots on the subsequent reviews. But what I am going to talk to you now, but it's just some high level study tips, how to prepare, how to get your headspace in getting ready to study for the exam, and talk to you about some of the tools that we have. So the first thing is, you're not starting from scratch. Even if you have not started to study yet, you're partway there because you have either an academic background in public health, or you have work experience in public health, or you have both. Like I said, that's why we set the eligibility where we do. So the studying process is just going to strengthen what you already know, give you an opportunity to fill in some gaps, but you're not starting from zero. So start like you're feeling confident that yes, you can do this. You just need to strengthen and fill in gaps. And that's really what you're doing. So we do have a number of study resources available on our website. I'm going to kind of show you where they are in a moment and walk you through how we suggest you use those study resources. But first, we do survey folks after they complete the exam, just to find out, like, how did they prepare and how long did they take? And so I'm just going to share some statistics with you. And this is not necessarily what we're saying you should do. Everybody's got their own way of preparing for an exam. I'm sure of you, in school, for example, determine that you can stay up all night and study and do well, or that does you no good and you just need to review your notes over time. What you should do is think about what was successful for you in the past, and it's likely going to be the method you should use to prepare for the CPH exam. So take this slide with a grain of salt, but what you can see is that the majority of candidates said they took about 3 months to prepare for the exam. So anecdotally, I've heard that what folks do is they break down their studying week by week and they go through all 10 domains, and that just about gets you out to 3 months. So that might be a way to look at it. And then some candidates do take longer. There are a few that don't prepare at all. Good on them if they can do it that way. I couldn't, but again, just think about what works for you, and that's probably your best tactic. So on our website, again, under the CPH section, we have a whole page of study resources right there. There's so much in that section, so I hope you've already taken a look if you haven't already. The first section is sort of self-assessment. So what you want to figure out first is, how ready am I? What do I need to do? So don't panic before you've gone through this process yet. So we do have tips for studying. So really get you thinking about your strategy for taking standardized examination. And we've got a couple other, I'm just seeing what's in my slides. So the first thing I would do is I would take a look at the content outline that is under the domains of each of the domains of the exam. So the content outline is really a list of the tasks. So every question on our exam is going to relate to one of these tasks. The content outline itself is long. It's about 10 pages long because we've got 10 domains. What I suggest you do is just scan it at first. You don't need to go through it with a highlighter and, go to it in too much detail at the first pass. You just want to scan it because, like I said, the domains you might have had a sort of a gut reaction to, the domains you might be familiar with, and those you're not, but the content outline is going to tell you more detail. So if you are scanning the content outline and you see domains and you're looking at the detail, the tasks, and you realize, I don't know what they're talking about, that's definitely an indication you need to study that particular area. And then you might see either others where you think, oh, I'm pretty comfortable, I think I know this. And, we'll leave it up to you to decide how much you want to study in that area, but at least you've got a head start there. So I would look at the content outline as one of your first steps. It's a PDF on our website, so you can just go grab it and look at it anytime you want to. So we do have some sample questions. It's just a few, it's about 10 sample questions. It's just so that you get an idea what our question format is. What do they look like? How complex are the sentence structures? How long are the options you have to choose from? Just to give you a really high level sense of what a CPH exam item looks like. But it's not enough to really do any self-assessment. So that's why we've got 2 practice exams. So I always say, in public health, we're evidence-based. That's what public health is all about. Well, let's take that same idea and apply it to preparing for the exam. So the practice exams, what you'll do is you'll answer 50 questions. Practice exams are free. They're always available. So you'll just log in, answer the 50 questions. And at the end, it will give you an assessment for every domain of whether that's a possible strength, whether you did satisfactory, which is good, or whether it's a possible weakness. And so that's your evidence. And so if you take at least one of the practice exams and you look at the domains that is a possible weakness, that's probably where you need to study. So I can't emphasize enough, please take at least one of the practice exams before you start down your path of preparing for the exam, because that's going to really point you towards where you need to study. So on the second section of our study resources page are tools that we have available for you. These are all the tools that we know about or that we offer. So number of different things. So we do this webinar series at least every year. And so we've recorded previous webinars that are all found on our YouTube page. So if you just click through the archived webinars, you can find previous webinars. And they address the previous content outline, but the content is still really, really good. So they're worth looking at in addition to the review sessions you're about to go through the next few weeks. And we get very positive comments from people saying that the webinars are super helpful when it comes to preparing for the exam. So take advantage of them. Again, they're on our YouTube page. There are a number of study guides available by different partners. So the two I'll point out is Springer Publishing has a study guide that's lots and lots of practice questions. If that's really where you think you need to focus, is practice questions. That's a great tool. And then APHA, the one on the right, has a practice exam. And what's nice about that one is that they actually have a chapter on each of the domains, so you can read through the content, and then it also has some practice questions as well. So for our new content outline that is going to be we're going to be testing under August 1st. Both of these will be revised. I know the APHA one, they're saying October of this year. Springer's working on it. They don't have a date, but I'm quite sure they're active in trying to update their study guide. These are still good tools. And I'm going to talk to you a little later about the difference, but they're still good tools regardless of when you're going to take the exam and when these are updated. We also offer in-person review courses whenever we can. We'll have partner organizations approach us and say, we want you to come to a conference and do a review session there for our members. So keep an eye on our website. So anyone that's open to the public, we will publish on our website. Just keep an eye on our website and we'll let you know if we have any of those planned. But certainly the most important tool I think that we've got is the review sessions that you're about to go through. So you're off to a good start. All right, so the last thing I'm going to talk to you about is the recertification process, because you're going to go to a lot of effort to get your CPH, and we want to make sure that you know what happens next. So like I said at the beginning, certifications are different than degrees and certificate programs, because once you're certified and you get those letters after your name, you need to keep it. You need to do something to maintain your certification. So the way our works, really break it down really simply, is every 2 years you need to report recertification credits to us. The way we define recertification credits is continuing education and professional development. So we're a little different than a lot of certification bodies because we do allow for professional development. So we allow for things that you do on your own. It's great if you do continuing education, which to us means you go to a conference or you participate in a webinar or you go to a training. Those are sort of didactic events that are hosted by an organization, and absolutely you can earn recertification credits for that. But we also give credits for other things like doing volunteer work, or maybe you wrote a journal article, or you're like a peer reviewer for abstracts or something. You give presentations, you can get credit for all those types of things. So again, we've got a very long list on our website of all the activities that would work. It's probably close to 30. So take a look at that. So we're easier to maintain than some other certifications because we allow for so many types of activities. The other difference with our recertification process is that we do not have pre-approved providers. So there are some organization or some certification bodies where you have to go to specific providers. We don't do that. Public health's too broad. We don't want to get in between you and the organization that you want to get your continuing education from. So as long as the topic's related to public health, it will count. All right, so once you're certified, we really hope you'll get involved with the CPH community. We're doing lots of great things with the CPHs. I'm just going to give you a few just to get you excited about what's on the other end. One, we have a book club that's been going for about 4 years now. We've got 1,500 members and read fantastic books. The discussions are led by CPH it's about every 8 weeks or so. So we invite you to join that. We have a super active LinkedIn group. So we'll post announcements there for the CPHs, but the CPHs themselves do lots and lots of sharing on that. So once you're certified, you'd be invited to join our LinkedIn group. And we also have a webinar series for CPHs hosted by Ashley. So every month we have a webinar on different cutting edge public health topics, all hosted by a CPH. We'd love to have you join in those. And then we also recently launched an ambassador program. So we've got almost 100 CPH ambassadors that are helping us with continuing education, with promoting the certification, with speaking to people and, giving them more information about certification in public health. So if you're certified, you'd be invited to apply to be a CPH ambassador. So again, I'm just going to, last thing, and then I'm going to open it up to questions, but I just want to go back and talk just a little bit about the change to the content outline, because I have a feeling you all are going to ask about that anyway. So we're getting lots of questions. So on August 1st, that's the date the content outline is going to change. So the exam will be slightly different. And I am going to say it is slightly. This was not a sea change. So the biggest change is that we reweighted the domains. So based on the results of our job task analysis, we realized we really needed to put a little more emphasis on some domains versus others. But the change is just a couple of items per domain. And what that means is maybe there will be 2 items less, maybe there'll be 2 items more, but it's a very small number of change in items. So that's really the big change. There were some minor changes to our item bank. We did have to write a few new items, but we do that every year. We're constantly updating the CPH exam. So from that perspective, we feel like this is not a very big change at all. So don't let the new content outline throw you. So if you want to go ahead and take the exam before August 1st, that's fine. But if you'd rather take it in August, I don't think you're going to see a big difference at all. All right, so I'm going to stop sharing my screen. And so let's see what questions you might have. Oh, goodness. Okay.
So I've been answering some of them live for you. I do have one question for somebody about the documentation of the training activities towards recertification. So if you could talk a little bit more of how you document your training activities. And I know you said that they can use anything, but if you could elaborate a little bit more on recertification.
Yeah. So we do on our website, we have a whole list of specifically these things count. So Ashley, if you want to grab the link to the document and throw it in the chat so they can see. So you should know what'll count, what not. It's fine if you ever want to email us and say, hey, will this count? People do, and that's fine. We're happy to answer that question. When you report it to us, you'll basically tell us what you did. It's just text. So you'll tell us the category, you'll just tell us the title of the activity, a little description, and that's it. You don't need to upload anything. So what we do is we do random audits, a small percentage of CPH every year, and just to make sure that we've got a rigorous process. And we'll ask you, what documentation can you provide? But most people are not audited, but you could be. So what my suggestion is, any documentation you have, throw it in a folder, put it in an email folder, throw it on your, drive or whatnot, and keep it until your certification has been, recertification application has been approved. Once it's approved, you can get rid of that documentation, but just hold on to it temporarily. And then I would do that every cycle, just hang on to it for, just in case you are audited.
Great. And then can you go through the cost of recertification?
Yeah, it's $95 every 2 years. So that's pretty simple.
Great. Then someone has a question about the tests themselves. So are the questions different on the updated, with the new content outline, or is it the same test?
The questions?
The question is about the tests. Yeah, the test questions.
Yeah, so it's this, you mean before and after August 1st? Yeah, it's the same bank. So what we did is we go through a process where we map we call it an item bank, is our group of questions that we have for the exam. And we just mapped it to the no content outline. And there were a couple of questions that didn't fit anymore. And there were a couple of areas that we realized, oh, we need to write new question. But I'd say 98% of the questions are the same. It's the weighting is really the big difference, but most questions that are on the exam right now will also be on the exam after August 1st. And that's why, you hear change and folks can get a little nervous and trying to figure out when they should take the exam. And I would say it really should not make much of a difference at all if you take it before July or August. And unless you want to take it twice, it's almost impossible to try to predict which version you should take. So I would say don't worry about the change in the content outline and take it when you think you'll be ready.
And then I have a question about, after I pay the exam fee, can I book any date for the exam, or does it have to follow a specific cycle?
No, it's completely open. The testing centers, all have their own schedule, but most testing centers you can schedule at least 3 months ahead, and some will let you schedule 6 months ahead. So you might be limited if you're trying to schedule too far ahead, but otherwise every option will be available to you.
Yep. And then we have a couple questions on what is the passing rate?
The score.
Mhm.
So after August 1st, we're going to use what we call skill scores, which means we will publish the scaled score. So you will know, like when you took the SAT, for example, that you had to get, I don't know, a 1200 on the SAT. We will publish that after August 1st. But unfortunately, we can't before we have administered the exam for enough candidates in August. So there's a whole process that I won't bore you with, but it involves committee meetings and some psychometric evaluations. But we will set the passing score for the exam and actually publish it on our website, that you will know what score you need, probably the very, very beginning of September. So whenever we update the content outline, we have to go through this whole process to set the new passing score. So I just couldn't tell you what it's going to be in August because we haven't had anybody test under the new content outline. But that said, I think your strategy would be the same no matter what we tell you your passing score is going to be, is do your best and take one of the practice exams because it is the most reliable. It's not entirely predictive. If you're in public health, that should make a lot of sense, that we can't guarantee how you do on a practice exam is going to be how you're going to do on an actual exam because they're different questions, but it is the most predictive, I think, of any tool you've got to how well you're going to do on the exam.
Great, thank you. Then we have a question here. Are you affiliated with CHES or MCHES, and what is the difference between certifications?
Yeah, no, we're independent organizations. We know them. We present with them sometimes. So, and a lot of the way we administer the exam and build our exam is fairly similar. The difference between the CHES and MCHES and CPH is that we're a generalized certification. And so we certify anybody working in public health. So we cover all the content in all the domains of public health. And CHES is a specialty certification, and they're focused much more narrowly on health education.
Great, thanks. People are asking about the current passing score. So before the August 1st. Do you want to elaborate on?
Yeah, so this is gonna drive you all crazy, but I can't tell you what it is because remember when I said you could retake the exam as many times you want? The reason why is because when you take the exam and you go back to retake it, you'll take a different exam. We administer multiple versions of the exam at any given time so that people can retake it, and not see the same questions, because that really wouldn't be fair. And so every exam, every version of the exam is slightly different. And that means some of the questions might be a little easier, some might be a little harder. So we have to have a different passing rate for each of those exam forms. And because I don't know what form you all would take when you register before, if you take it before July, I would have to like look up all the exam form pass scores. But we realize that that's frustrating because some, folks just want to know an answer. And that's why we're moving to scaled scores, because that will equate all of the passing scores. So you'll just have a number that it doesn't matter which form you're taking. And I really apologize if that was confusing as all get out, but the examination process has a lot of technicalities behind it. So that's what we're doing, everything we can. And I think the scaled scores is going to be a move in the right direction so that we can at least clearly answer that question, because it won't matter which form you're taking.
Okay, great. So one of the next questions is it true that the new score report will tell you how your scores compare to other test takers by percentile?
No. I don't know where that came from, but that's not true. I'm sorry.
Yeah. And then just some advice someone's asking for. Do you recommend that they attend all the upcoming sessions before they book their exam for this year?
Because they want to take it this year. Is that what you're seeing in the
I
question?
think so. And I think I would say it's probably very personal to your own study.
Yeah. And like I said, I think you're gonna love the review sessions that you're about to go through. They're dynamic speakers, especially if you can participate in person. But if you cannot and you want to go ahead and take the exam, then I'd say watch the archived review sessions. Some of the same presenters, and I think that's useful as well. But again, like Ashley said, it really depends on your situation, so it's kind of hard for us to say, without knowing more.
Yeah. And then I have gotten a couple questions that are very specific to your certain situation. And so I've put the info at nbphe.org in there. If you can email that about your, and we'll be happy to help you out. Allison, another question is about how soon after they take the exam will they get the results and know if they're certified?
Usually the answer is going to be immediately in August, because we need to set the passing score. So you wouldn't get your results if you take the exam in August, but anytime after that you should. But I'm going to say, please don't wait and not take the exam in August because of that, because you will have the results anyways. And we need a lot of candidates to take the exam in August so that we can set the passing score. But that said, moving forward after September, as soon as you hit submit, you will know if you passed or failed.
And then someone says, just to confirm, I noticed that some of the names of the domains have changed, but to confirm again, the content will be the same.
The contents, so the names are just names. The names don't matter. We could call the domains anything we want. It's just categories. And there were a couple, we just didn't like the old names, and we decided the domain names need to be more descriptive. The tasks, the content outline is the map. That is our blueprint of what the exam should look like. That did change, and you can go on our website and compare the old and new content outline. What did not match much, or did not change much, any more than it does in any given year, is the item bank. That did not change much at all. So we have a bank of, I don't know, hundreds of exam questions. That didn't change much at all. There were a few questions we threw out, and there were a few questions we're writing now, but we do that every year. Every single year we do a round of item writing and a round of item review. We put together new test forms. So the change is not significant. So I'd worry far less about, well, I wouldn't worry about the domain names because like I said, we just didn't like the old names. In a couple cases, we wanted to be more descriptive. But the changes, you will see if I had to quantify it, I would say are in the 2% range for any given domain. They're very minor. And Ashley, I do see, are the present practice exams still predictive of the new exam? We are updating the practice exams on August 1st. That said, I think the present practice exams you can find now are still going to be predictive. They'll be slightly more predictive after August 1st, but go ahead and take a practice exam. It's still going to be a good practice and they're free. So why not?
The one question about, do you know exactly which questions you get wrong or just the section you're weak in?
In your score report, it will give you the total number of exam items that were possible to get right and how many you got right. But we don't share these specific questions for exam security purposes.
Is the practice exams will change after August 1st? Yes, we will be updating the practice exams as well.
Yep.
Oh, that looks like all of our questions right now.
So there's one question, in our universe, they told us that August 1st, everyone will have different passing score depending on which questions the computer chooses from the question database. That's not exactly correct. So the computer doesn't decide, we set the forms. And so it will depend on which form you're taking. That much is true. But like I said, we will have a scaled passing score. So you'll get a finite score that you need to get to pass the exam, no matter which form you take.
Okay, it looks like we got a couple more while you were answering that one. How long do you have after you've been approved to take the exam?
Right now in our system, it's 10 years eligibility, but we've never revoked anybody's eligibility. So as long as you stay current in our system, we still got your contact information, then you can take it anytime you want to. And we never expired anybody.
Yeah. So someone's asking about, once I have my CPH, does this make me more marketable?
I would say absolutely. There's a couple slides I didn't show for the sake of time, but certifications really resonate with employers. And so the CPH is getting lots of uptake. We've got health departments getting their folks certified. There are jobs that are looking for the CPHs. But even if you find that a specific employer maybe isn't advertising for the CPH, there have been studies done by the Institute of Credentialing Excellence that show that employers understand the value of certifications. And so if you have, if they're choosing between a candidate that has a certification and one that's equally qualified that doesn't, they're going to choose the candidate with the certification. So it says a lot about your commitment to the field, your competency, your ability to be conversant in many areas of public health besides your specialty area, and your commitment to continuing education. So yeah, I would say absolutely yes, it makes you more marketable.
Then to confirm, we'll just get a pass. Sorry, I lost that one. We'll get the pass fail. We won't know where we fall on a scaled range.
So when you take the exam, you'll get pass fail, and then after September 1st, you'll log back into our website by the next day, and then you can print out your score report. And what your score report shows is for every domain, the total number of questions possibly you could have gotten right and how many questions you got right. And that's what it tells you. So what you walk away with when you look at the score report is you will be able to see the areas you did better than others. Because it'll give you, I believe it gives you the percentage, you know, you got half of the questions right in this domain and all of the questions right in another domain.
So after the exam, how many days can we expect till we see the results?
The next day, it's overnight. Our system updates overnight, so usually by the next day you can see it.
And then I just wanted to let you know, everyone, this is recorded. The recording will be available by tomorrow. So I will send out the link to everyone registered. So you will have availability to this one and all other future sessions. You see any more items in here? Okay, I do not either. Well, if there's no more questions, we will end today's session. Our next session is next Tuesday. So I look forward to seeing everyone. And then, like I said, I will send out a link for the recording for this session, and that will be the same session link for all future sessions to be able to see any of the recordings that you may miss. So thank you once again for being here today, and we look forward to seeing you next Tuesday.
All right, it was a pleasure. Thank you. Thank you, Ashley.